So you want to talk about number 4, about predictive medicine and what we've created called the ARC, which is our version of predictive medicine.
Well, yeah, and you look at what insurance companies have been doing for many, many years in gathering data, gathering information from hundreds of thousands, if not at this point, millions of cases that they've looked at, and they look at average of what the diagnostic code was, the time that's required for treatment, what treatment was required, what's the cost of treatment, what they've had to pay out. And they look at these averages and they say, if you diagnosed X, we're going to pay Y. And that's it. Because we've got hundreds of thousands of cases that show X means we pay out Y. That's it. And the patient's done. So unless you give something better that's going to change that, you can't expect to get paid by going, hey, I treated them 400 times, but they just said they weren't getting better. You have no evidence that they weren't getting better or the reason for why. So if you go back to predictive medicine and you say, well, if I know X, then this is what I expect is Y. But what if X wasn't 100% true? What if X changed by week 2? Or maybe when you took x-rays, or maybe when you got MRI results back, or you sent the patient for an additional opinion, and that came back with additional information. Have you updated your records? Have you talked about those things in your records to say, hey, this is what I thought, but here's what I've learned since then? And this may create a situation where the patient does not progress as expected and may take longer, right? You have to say those things. In our system, we've built in a 30 to 45 day exam and a 90-day exam. So we go back and we look at what was done on day 1, we compare it on day 45, and we compare it again on day 90. That's what gives us a longitudinal study of how the patient is doing. And does it match what we expect, or does it not match what we expect? And if it doesn't, then why not, right?
Well, at least we're telling the insurance company where their GPS and their map are matching or they're not matching, right? Because right now, the issue that is happening to the primary care physician, chiropractor, acupuncture, or physical therapist, their diagnostic codes, right? And then they're skin in the game for the number of treatments that they're doing, right? So the argument is you overtreated. Well, how did you establish what you were going to fix objectively if you didn't provide that information? So your only treatment plan is based upon symptoms. And if the symptoms are not associated with an injury that was caused by the car crash, then really, why should we pay you anything for your treatment if you didn't validate that step-by-step process?
Right.
Right. So that's where Modern Health View comes in, right? We're independent. We're diagnostics only. We don't do any ongoing treatment, right? The purpose is clinical clarification, not legal liability, insurance coverage, or case valuation. We establish the complete injury picture, body, brain, behavior. Like behavior is a really important component, right? Which we've discovered after 5 years of having major conversations that kind of blew our minds, right? Create objective functional baselines and communicate one clinical reasoned record. Pretty simple. And if you're not doing this, which we know you're not, because based upon the hundreds of conversations we've had with attorneys and primary care physicians, they're not doing this. You need to hire us, because guess what? You're not going to get paid. Neither is your patient going to get the coverage that they deserve and the treatment they deserve and the funding that they expect to see, right, at the very end of the case.